Welcome to the Pediatric Hotline, where today's episode is going to cover fever reducers and the proper dosing of Motrin and Tylenol. Now, I already have a video in regard to general information about fevers in the pediatric population, and I'll post a link below so you can watch that video as well. Pediatric medication doses are based on body weight. Motrin or ibuprofen can be given to any child over 6 months of age and can be given every 6 hours as needed. Tylenol or acetaminophen can be given to any age group and can be given every 4 hours as needed. Both of these medications come in liquid or pill form. Motrin is dosed at 10 milligrams per kilogram of body weight. Tylenol is dosed at 10 to 15 milligrams per kilogram of body weight. In the United States, weight is primarily measured in pounds and/or ounces. Body weight must be converted to kilograms to calculate proper dosing. To obtain body weight in kilograms, divide body weight in pounds by 2.2. Now let's work through a few problems. Let's look at an example of Motrin dosing. Let's say you have a child who weighs 27 pounds. Divide 27 pounds by 2.2, which equals 12.272 kilograms, but round it off so you have an easier number to work with. So the body weight in kilograms is 12 kilograms. Therefore, Motrin dosing is 10 milligrams per kilogram, so multiply 10 milligrams times kilograms of body weight, which equals 120 milligrams of Motrin. Motrin liquid concentration is 100 milligrams per 5 milliliters, or 20 milligrams per milliliter. So for a child at 12 kilograms of body weight, 120 milligrams is equal to 6 milliliters of Motrin. 120 milligrams divided by 20 milligrams per milliliter equals 6 milliliters. The proper dosing of Motrin for a 27-pound child is 6 milliliters of Motrin. Let's look at a second Motrin dosing example. Let's say you have a baby who weighs 5 pounds. Divide 5 pounds by 2.2, which equals 2.272, but round off again so you have an easier number to work with. So the baby's body weight in kilograms will be 2 kilograms. Motrin dosing is 10 milligrams per kilogram of body weight, so multiply 10 milligrams times kilograms of body weight, which equals 20 milligrams of Motrin. Motrin liquid concentration is 100 milligrams per 5 mLs, or 20 milligrams per ml. So for a child at 2 kilograms of body weight, 20 milligrams is equal to 1 ml of Motrin, because 20 milligrams divided by 20 milligrams per milliliter equals 1 milliliter of Motrin. Proper Motrin dosing for a 5-pound baby is 1 milliliter of Motrin. Now let's look at a Tylenol dosing example. Tylenol can be dosed at 10 to 15 milligrams per kilogram. Usually we use the higher dosage, so we'll be using the 15 milligram per kilogram calculation. Again, we have a child at 27 pounds, so 27 divided by 2.2 equals 12 kilograms in body weight. Tylenol dosing is 15 milligrams per kilogram, so multiply 15 milligrams times kilograms in body weight, which equals 180 milligrams of Tylenol. Tylenol liquid concentration is 160 milligrams per 5 mLs, or 30 milligrams per ml. So for a child of 12 kilograms of body weight, 180 milligrams is equal to 5.625 milliliters. But this is not an easy volume to work with, so round down to 5 milliliters to make it even and easier. Remember, Tylenol is 10 to 15 milligrams per kilogram, so rounding down is still within the proper dose. 180 milligrams equals 32 milligrams per milliliter, which equals 5.625 mLs, or 5 mLs. 5 mLs is the proper Tylenol dosing for a child who weighs 27 pounds. Now let's look at a second Tylenol dosing example. Again, we have a baby at 5 pounds of body weight. Divide 5 pounds by 2.2, which again gives you 2 kilograms in body weight. Tylenol dosing is 15 milligrams per kilogram, so multiply 15 milligrams times kilograms of body weight, which will give you 30 milligrams of Tylenol. Tylenol liquid concentration is 160 milligrams per 5 ml, or 32 milligrams per ml. So the proper dose of Tylenol is 30 milligrams. However, the lowest concentration of Tylenol is a bit too high of a dose for this baby, so we can give a bit less than the 1 milliliter dose. 30 milligrams divided by 32 milligrams per milliliter equals 0.9375 milliliters. This is difficult to measure, so giving 0.75 milliliters is easier and still within the range of appropriate dosing at 10 to 15 milligrams per kilogram for Tylenol. For older children who weigh generally over 40 kilograms, you can give adult dosing or the standard pill form. If they are unable to take a pill, they can get the equivalent in liquid form. For example, Motrin dosing is 10 milligrams per kilogram, so a 40 kilogram child can get 400 milligrams of Motrin. Tylenol dosing is 10 to 15 milligrams per kilogram, so a 40 kilogram child can get 400 to 600 milligrams of Tylenol. If your child is old enough to get the adult dosing of Motrin or Tylenol, never exceed the maximum adult dose for Motrin or Tylenol. The best way to measure proper volume in babies and smaller children is with a syringe. A 5 milliliter syringe will be appropriate, and your pediatrician should be able to supply you with one. If the dosing calculations we went through in this presentation are confusing for you, you can refer to the Motrin or Tylenol box for dosing recommendations. However, in my experience, these recommendations are always below proper dosing volume. Hence, they often do not reduce the fever. If these calculations still are confusing, call your pediatrician. They can guide you about giving your child the proper dose of Motrin or Tylenol. Thank you for watching the Pediatric Hotline. I hope this was helpful, and I would appreciate if you give me a thumbs up and consider subscribing to my channel. If there's any topics that you would like to see covered in pediatrics, please comment below. Have a healthy and wonderful day.